Welcome to the Dogish podcast, the only podcast dedicated to the dog parents and topics and events and personalities impacting their lives today. My name is Jasen Arias, co-founder of Forever USA. We just launched a new series of books on Amazon, by the way.
You did?
Yeah. We took all of our rescue stories. We have 3 books from 2017, and we're getting ready to get 2018 and 2019 up too.
Oh, I love that.
Yep. And always, Sylvia, how are you?
Hi.
Dog mom extraordinaire.
You're never going to get this right.
Pet expert. You know what? I was actually listening to the other ones and I was like, I got this. And then we get into it and there's something when I'm reading, my brain frazzles. So I'm sorry. I'll get on top of this.
Dog mom.
Yep.
Repeat after me. Ready?
Dog mom professional.
Nope.
Dog mom.
Listen, dog mom.
Yep. Dog mom.
Certified trainer.
Pet expert.
You got this.
Dog mom extraordinaire.
Sounds the same.
I love it.
All right, let's get into it. Today we had Dr. Lily Chen on.
She's awesome.
Amazing.
I had a lot of fun with her.
Integrative medicine.
Yep.
Jasen tried
Wholistic.
mansplaining. It's a whole thing.
Okay. In fairness, I do apologize if it came off as mansplaining. Like, I wasn't trying to talk to you about what crystals were. Like, I can't tell you what crystals are.
Okay,
like,
we're spilling all the tea.
Jump into it.
Let's just get into it.
Let's go to it. All right. Welcome to the show, Lily. How are you today?
Good. How are you doing?
Not too bad. Do you have patients at the practice today, or is today?
Do. I have an appointment. Well, I've been doing house calls this morning.
Okay.
Fighting LA traffic. And I have just one more appointment after this.
Oh, very good. Anything exciting?
They're all exciting.
They're all exciting.
Good answer.
There has to be some that stand out. I mean, there's always, like, there's good days and bad days. Like, we do the same thing with the photography stuff. Sometimes they're more exciting and we have 5 Labradors in the studio, and other days they're less exciting and it's a quiet basset hound that doesn't want to move.
It depends on how you look at exciting, because exciting in veterinary medicine sometimes isn't very good things, or if we say interesting, that's also sometimes not very good. So sometimes a boring, nice day where all the pets are happy and they're being healed is a good day for me.
That's a good day.
So how much has your practice changed since, because I know working in the pet industry, there are so many dogs. And like, I went to go take my dog to the vet the other morning because he wasn't feeling well, and there was nowhere to take him. How is that affecting you?
It's definitely affecting me a lot. I mean, my practice at Integrative Pet Wellness Center, it's a newer practice. So my journey, I think it kind of goes back to I started this practice about, I guess officially about 6 months ago. But I was working in an animal hospital, and when COVID started and what you're describing, it's just like nonstop, and I could be seeing 5 patients in a 20-minute slot.
Whoa.
And it's hard because you come in and appointments are booked. And you have walk-ins, you have emergencies, you have people on the phone, a lot of questions, you have patients already in the hospital, and you're trying to juggle a lot of things all at once. So there's definitely been so much of that, like across like everywhere. I mean, internationally, I feel like I talk to colleagues in like other countries and they're seeing the same thing. So, part of me creating this is I was doing house calls as my personal practice for more holistic patients. And I also started to get really, really busy in that aspect. So late last year, I had to really make a decision because I felt like I needed more time with my patients. I wanted to create like a more intimate and personal experience. So what you're describing, like that really affected me, I think on both sides of like, pet parents not being able to get their pets in because there's so much going on. And but also on the veterinary side of not being able to get everybody in, or being able to get everybody in, but everyone is got like really short time where you can't provide the care that maybe you're not, because we're really, at the end of the day, there's only so much time. So when I created this process, I really set out to be able to create a better system, so we don't have to feel rushed and people can get in and be seen. And hopefully down the road, as we get busier and busier, I can still have a system where I can have that time and space and not having to be.
So what does that mean? Like, as far as, I mean, so we're using words like integrative and holistic, and just a better overall system to improve the experience. What are some of those things? Because I think, like, as a dog dad, I mean, there's certain pain points that we've all experienced going to the vet, which is different 5 years ago versus 5 days ago, and how that all works. But like, kind of catch me up on what is different on what you're doing right now versus what most people might expect at a, let's say, traditional veterinary service.
So I am doing integrative, which means that I'm combining holistic medicine into conventional medicine. So I still do conventional medicine, although most people that are coming to me have at least like a holistic interest for their pet, and a holistic focus. I think there are a lot of hospitals that are doing excellent job in providing primary care, but what I'm finding is that there is definitely this group of people that like, I just need a little bit more. I want to talk a lot more about diet and lifestyle, supplements, like all these things that really cannot be addressed very well on the primary setting. So what I have set out to create, and the reason why I think right now I can carve out that space, is I don't see emergencies. For example, if a pet parent calls and a pet is having a true emergency, they get referred. So that does help with the caseload on my end, is to not have like the walk-ins and emergencies, which are the ones that usually throw the schedule off. And my appointments are half hour. For new pet parent, it's an hour, but we also do like a half hour telehealth just to get to know each other, run through the history. So I really know them very well by the time they get here. So let's say like if you're a new pet parent, like you would have already talked with me for half an hour, and I've reviewed all of your records in detail, and I understand your goals and what you want. So by the time you come in, we already have a treatment plan. So it's not you coming in and having to describe what the problems are and what's going on and what we're here to do. So there's that part. And our appointments run completely on time. Like the latest we've run is maybe 10 minutes late if somebody's really late, but we run really on time. Our appointments start on time and they end on time. And I think that's really important for keeping everybody on schedule for the day to flow well. So for me, that's important, because I think everybody should be given the same amount of time. I'm not going to take away from this pet to give to
give to somebody else.
Yeah, because sometimes it happens. Like maybe if a pet doesn't have as many issues,
Sure,
about your next dog is having vomiting and diarrhea, it's like, okay, I'm just going to wrap this up so I can have a good time.
Exactly.
So I'm really trying to change that, and my clients all know, like, this is your time slot. So if you're running 10 minutes late, you can decide if we're going to reschedule or you're okay with the 20 minutes.
Yeah.
Okay.
I think this is a really good place to take a quick break. And then when we get back, I want to dive in with you a little bit deeper into this idea of holistic medicine for dogs.
Me too. So I want to know what that word means.
Okay, so we're back. So I can see where like you're really trying to remodel this whole idea of like what veterinary care looks like. And as a dog mom, I resonate so deeply with what you're saying because it really does feel when I go to the vet, like I don't really feel like I have a veterinarian per se. Like there's just a hospital that I go
Mhm.
to. Even though it's the same doctor that sees my dogs, I don't really have the opportunity to build a relationship with that doctor, you know. I did have an opportunity to build a relationship with a great vet, Dr. B, when I was working with my senior dog who passed away last year through some chiropractic care. So I'm a big believer in like holistic and alternative medicine integrated with Western medicine. I do that kind of care for myself, you know, like I integrate traditional medicine with other more holistic practices. So something that you said that really kind of like caught my ear that I'm really passionate about is you were talking about like nutrition, diet, supplements. Like, how often do you address that with your clients? And did you take nutritional courses on top of? Because most vets have no idea about that kind of stuff.
Yeah. So your question is about like how, so there were, I feel like there were a couple questions there. So
I heard them all too.
Mostly like let's start aiming into nutrition and supplements because it's so important. And I feel like that's probably my biggest pain point with my clients when I'm working with them is like vets just have no idea about nutrition at all. I'm like, did your vet talk to you about immune boosters? And they're like, what's that? I'm like, oh no. So talk to me about like that kind of stuff and how you kind of how that integrates into your more primary care.
I talk about nutrition every client, every time. We start out, so any new patient that comes in, and the reason why I do that telehealth was that I found out through my experience is that there was no way that I can address everything in the visit that they come in. And so much of that is very personalized. So nutrition to me is very individualized. It's not, I don't have a blanket recommendation to be like, do this diet and it's fine, or do this brand, it's fine. Because you would feed a Chihuahua differently from a Great Dane. You would feed a puppy differently from a senior dog. You would feed, kidney issues, or if you're trying to prevent kidney issues, this breed is predisposed to stones and they run hot, they run cold, like all these things. So there's a very detailed little form that I have them fill out that even tells me about their pet's personality. Do they like to be cool? Do they like to be hot? It goes into a lot of what we feed because foods have energetics, right? Like we hear about raw food and we hear about fresh food, and then there's kibbles and such. And they all have they all have energetics, and they can treat conditions. Food is medicine, and in my practice, that is the foundation for everything. So every patient, every time, almost we'll touch on diet. How's that going? If there's a condition we're treating, my first thing is to go to the diet and talk about what we're doing. And I can't tell you how many times just by changing the diet, it changes everything. My training in nutrition, so in vet school, basically nothing. So,
thank you for saying that out loud because so many people don't understand that. So for all the pet parents,
I feel like
all the pet parents, it's very true though.
There's some training, but not a lot.
I mean, you probably learn about as much about nutrition as you do about behavior, which is not a lot.
One rotation, it's like 1 week rotation, and you have a very short course that is like 1 hour per week for 3 months in our curriculum. So, I mean, I am going to come on and say, like, I didn't feel like I was trained in nutrition at all. And then we are taught to kind of, even in vet school, to kind of be like, oh, these are the brands that are scientifically based, they're nutritionally complete, and these are great foods. And honestly, for years that I did that. But then I just started seeing a lot of issues. Like they didn't improve with this prescription diet. Like what else, and I also didn't see the reason why I got into holistic medicine is a lot of chronic diseases. It's not just about giving medicine after medicine. It's about trying to change the body so it can heal itself. And then food becomes like such an important part of it. So I did have additional training. I went to Chi University. It's a very one of the biggest kind of like holistic veterinary education center, and they're based in Florida, and they have a great like food therapy course. But even throughout my training as more in like the holistic modalities, almost every subject that I study, if I'm studying oncology like cancer, or I'm studying dermatology or how to treat that holistically, there's always something about nutrition. So I think that is the foundation for everything. And most of that, or all of that, was learned after vet school.
I think that's been one of the biggest mental shifts for me, even since starting this podcast, is the impact that, I mean, I know it seems obvious that food would have that big of an impact on our pets' lives, but the average community just doesn't put enough of an emphasis on it. So, I mean, we're just hit in the face every single day with kibble, 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 kibble. In fact, it's the chewy stuff that is like the bad stuff that we think of. What's that? Like the kibbles and bits, right? That's the bad stuff. So this whole world of holistic and fresh foods and raw foods, it doesn't seem accessible enough. I guess it's gone a very similar route as the way fast food has gone, to where fast food is just so easy and restaurants are so easy. And what you have to invest into and understand and learn about eating healthy at home for yourself is very similar as it is with our pets and dogs.
Yeah, it really is. And a lot of it really comes down to, I think when we buy a bag of kibbles, we're really buying convenience,
Sure.
But I also think that there is a trend, I think, as we have more access to information. I think pet parents are also getting much more educated, so they start to ask questions. And I think it's a really good direction. And then a lot of us are starting to be able to talk about it more without so much criticism, might I say. It is a very controversial topic sometimes, but
Super,
I read it wholeheartedly because I see the difference. But I know that a lot of us in this space, we're all kind of fighting towards the same goal, is to bring that more forefront in front of the parents, and they see the changes, and hopefully, one by one, that will be able to change how we see feeding.
Is there a subscription company out there yet? Either we need to run with the idea or somebody else is going to have taken it already, but like the way that there is like Purple Carrot, is there anything like that for dogs?
A subscription as in like dog food shows up, like
Money.
Absolutely.
Farmer's Dog, etc.
Are
you talking about like cook it yourself at home subscription?
Yeah.
No, that doesn't exist. It should though.
Take it back. We're going to edit that right out.
Just kidding. No, but I think also too, what's been really interesting to see kind of shifting in the pet industry and in clients' minds and in humans' minds, pet parents, is this idea of like there are now investments being made into studies. Like there's that great study out of Purdue University about adding greens into your dog's diet, and like the 90% reduction in cancer appearance just from like a simple, just some greens. So what I think is so great is like those studies are happening. We're starting to get science to back the things that like we know are true, but aren't really mainstream. I think food as medicine, even for humans, isn't very mainstream. I go to my gastroenterologist and I'm like, oh, I'm trying to avoid these foods because they're really inflammatory and not great. And she's like, if you feel like that works for you, I'm like, this is science. I don't understand. It's very strange that I feel like the two worlds are so separate, between like traditional medicine and what is considered like holistic, which I think is just like, or natural medicine, if you will. I don't understand why they're not being married more. I don't understand why they aren't working together. What's your experience like as a veterinarian, like having transitioned now? Like, what are your colleagues who are still like full on traditional medicine? Like, what's that like? What are those conversations like?
No, for sure. Like it's part of the what you said, right? We're trained to really want evidence-based medicine. So the problem with holistic medicine has always been that there's not enough research. The problem with research, in my mind, my humble opinion, it's hard to get people to do those research for holistic medicine because there's no
money in it.
Who's backing it up? Like when you have a big study for a drug or a big company that provides food or something, like they can pay somebody to do the studies. And it's really hard, like for I think for things in holistic medicine, you're trying to prove that, you know, it goes into, I think, like economics of things and marketing and like what's in it for like you doing it out of the goodness of your heart and your time is not being paid for. And sometimes those are very realistic pieces, like who is going to spend the time running this study and cost huge amounts of money and gets nothing out of it. But I do think there's part of research. I don't know if I'm wrong, but I just felt like, how come there's not more evidence to support holistic research? There's more and more of it now. I think, like, let's say acupuncture, for example, you know, I think just short, like maybe like 20 years ago, people think it's, you know,
magical, hocus pocus.
Yeah, like
and then I think it kind of like doubles down, because then you get people that they're going to go off and do their own research and do their own things, but maybe they're a little quirky, should we say, and then it like makes it difficult to trust them. You know what I'm saying? Like we see all these experts, whether they're on TikTok or whether they're on Facebook or Instagram, and they're self-proclaimed experts, and they're coming out like you should do this, and even though it might be the right idea, not being scientifically backed, they're coming in with untrustable content and resources, and it almost works against the whole system, if that makes sense.
Yeah, absolutely. I do think that then there's like a whole set of like, there's things that are just out there that really is truly out there.
It's way out there. Okay, that's a good place. We're going to take a quick break. We'll be right back. I'm so glad you brought up acupuncture. More on that right after this break. Okay, so right before the break, we're back, by the way. Everyone, welcome back.
Welcome back.
So right before the break, Lily kind of touched on the idea of acupuncture a little bit. I am a huge believer of acupuncture medicine. I use it for myself. I've put my autoimmune disorder into remission 3 times using acupuncture, which is something that my traditional doctors told me I would need pounds of steroids to do. I'm still steroid free. But what I think is really interesting about acupuncture for dogs is they can't talk to us. So there's no such thing as like placebo effect, which I know is like the big thing for acupuncture. Is like, oh, it's the idea that it's working for you, this placebo effect. But dogs don't understand placebos. They just understand the difference between like being uncomfortable and then not being uncomfortable anymore. So do you offer acupuncture in your practice? Are you a practitioner?
Yeah, I'm certified in acupuncture, and acupuncture kind of built my practice and
amazing
built me into a holistic doctor. So
how do you get them to sit still?
Hadi, that's one of the most common questions. They do. Most of them do, like, because the needles, once they go in, have a relaxing effect.
It's very relaxing.
Usually the smaller ones are harder. Like the smaller pets you get, the harder it is to get them to hold still. And I think they're just not wired that way. It's like, why am I just standing here? But a lot of my patients, they would lie down and some of them just go to sleep.
Wow. Like
I go to sleep. My acupuncture appointments are like my built-in weekly naps. I'm like, oh, I'm gonna go take my nap today.
See, our audience has to be getting a fairly clear picture between you and I right now. Like you're like acupuncture and like all of like I'm the and like not the anti-holistic guy, but I'm not doing the holistic stuff.
Listen,
right?
Jason's
I don't talk
very
like I'm
mean
not into
potatoes.
psychics.
Jason's very mean potatoes.
Acupuncture, never done that. I don't even like massages, to be honest. And
What?
so,
I
yeah, it's
literally
not
just
my
had a
thing.
massage last night. Like literally hit the chiropractor and the massage therapist yesterday.
So this is just fascinating to me, and I love that this is out there. I love that this is something for our pets, but my mind is just like, there is like, I can see Max. So Max would like totally kick back on his back and he would let you acupuncture him all day long. But Lucy is just an insane tornado right now that I can't imagine taking her in and having that like
a bunch of needles put into her body.
Yeah. Like she's
so we should step back. I mean, now I practice acupuncture for, I want to say, almost 8 years. There's only been one dog that I cannot do acupuncture for. One dog.
How many patients is that, do you think, like in 8 years?
Oh, I have no idea.
Thousands of dogs?
Thousands? I don't know, because usually I don't think it's thousands, because it's usually the same pet that I acupuncture for a really long time, rather than like a lot of pets. Like I don't get.
I'm gonna come see you, Lily. I'm gonna bring you my babies.
Yeah, that'd be great. But I wanted to just challenge Jasen a little bit,
please,
because I will tell you my own journey. Is I was not a non-believer at first. I'm practicing in like specialty and emergency and like busy primary care, and I was doctoring. It's going great, and then the thing is, then I started getting like, then a few years in, like the patients that I really bonded and fell in love with, like as they get older, they start to have arthritis and cancer, and all I had was drugs to give them.
Yeah,
and they just didn't get better. Like, and then I've had to like euthanize pets because they couldn't get up, or they have arthritis issue. It was like breaking my heart. And that's why I started this. And also around the same time, my personal journey was, I had this, when I get into like maybe the zone of like too much personal detail, but
not at all, not on this show.
I'm already crying.
Since I was little, or since not like that little, but I've always had like bad menstrual cramps, like to the point that it's hard for me to function as a human being the first day or two of my period. Like always had it.
Relatable.
Yeah, and then totally. My doctor, I've seen different doctors, and like they could never find anything wrong. You're like, you're healthy.
There's nothing wrong.
Just take Advil. Just take Advil. Just take Advil. And then everybody was like, oh, and then take Advil like 2 days before you think your period's coming, just to prevent the inflammation.
Isn't Advil really bad for your liver?
It's
like
so
if you're
bad.
It's so bad, but that was the only.
And now they've proven.
I
now ibuprofen, they've proven causes blood clots. It's like, it's super cool. Like,
sweet.
Yeah.
I've gone through phases of my life of eating that stuff like candy.
The best. All right, so go on, Lily.
Right, so I would be like popping Advil just to be able to function. And then I get to like childbearing age, and I want to start a family. I was like, and I intuitively, I'm like, I want to get my body as healthy as possible. So I'm like, I'm not going to do this anymore. So I'm like, I'm going to try other things. And I saw an acupuncturist. He like put needles in. And that month I was 70% better. So part of me was like placebo effect, but I'm like, I don't care. It's working. I don't care. It's placebo, whatever. But I was actually a non-believer. I was like, it's not going to work. But I tried it. I was like, but I didn't think it was going to work. And it still worked. And then I got on herbs, and I had like one more treatment. And I was on herbs for like 3 months, and I never needed Advil again. So I'm like, whoa. So, and that's when I started looking into it for pets, because I'm like, there's something here. Like I needed to explore. But even when I finished my training and I started putting needles, like I would say for the first year, I was still very skeptical. I was like, this isn't going to work. Like, how's like these little things going to like change anything? And it's that case when a dog comes in and mom is in tears, like, my dog can't get up. I think it's time. And I'd seen this dog like wagging the tail and just like not ready. And I'm like, can we just try? Let's just try. I mean, what's the worst that can happen? It doesn't work. And right after the session, the dog got up and like kind of like danced out of the clinic. And then I treated that dog for like 2 or 3 years more after that. And
wow.
That changed my world. I'm like, you know what? like you said, like Sylvia, that there's no like placebo effect. So
I just don't understand it.
Good enough to like
Yeah.
get up when it hasn't been getting up. I'm like, there's something here. And now there's like a ton of research out there explaining why acupuncture works. There is scientific evidence. I do truly believe that it still doesn't explain everything. I think there are things about things like acupuncture that even
like the chi and stuff, that stuff that we just don't understand. I mean, here's the thing about acupuncture that I think is so crazy, not to exhaust this topic, but like it's been around for so long. Like it is such an ancient practice. And the fact that like we're still picking it up today, come on, you know?
And I mean, I should probably put some kind of divider in my thoughts on all of this, because I can understand the impact that acupuncture does make. Like there's something in my brain that's like, okay, that makes sense. But I also see where a lot of this stuff, and I'm not saying that I have no idea if you would suggest this or not, Dr. Lily, I don't know, but like other people are like, oh no, you need this special crystal and you recharge it in the moon and you're going to put that in your window. Like that kind of stuff is where it loses me. So diet, to me, it's sad that diet is even included in holistic medicine. Like to me, that's just true. Like that's, you're eating like crap and you need to eat better, and we need to teach people how to eat better. And that's just common sense. So it's like this whole idea of holistic is so vast, and it gets like so many things that are really put into it, to where I don't think diet should be in there, because diet to me is overly obvious.
But then you can make the argument for like, is chiropractic care not holistic then? Is acupuncture not holistic then? Because there's science to back that. I mean, I think I
don't even know what you would define as being holistic.
Oh, right. That's what I was going to say. Maybe we can come back to my definition. And I wrote a blog about it. Holistic medicine, at least in my mind, is a medicine for the whole body. For the body to heal. And holistic medicine, under the whole umbrella of holistic medicine, includes your conventional medicine. Like even if you're taking drugs or you're going through surgery, you are, doing your conventional therapy. To me, that's part of holistic medicine. Practicing holistic medicine to me just means that you're taking care of your body as a whole. So
exhausting all options.
I would fall under
but you're including the opportunity for additional tools to make a difference.
Because you are taking into account like what else can help this body heal. So for you, and I think that it's different for everybody. So let's say a person, for example, like crystals, because I think there is a huge part, and this is also scientifically proven, is that there is an emotional and physical connection, right? So people need to be emotionally well to be physically healthy. So for somebody like, maybe like for myself, like having crystals makes me happy. And that is going to make my body healthier because I feel like I'm balanced in that way. I do think there's like some science I can go into about crystals, but I'm not going to.
No. And if you can, I would love to hear.
You can with me.
Yeah, but I think it's like sometimes. Okay. Not dangerous. I went and I walked through. So my wife is totally on board with you guys. Like she should, if she was sitting here, she'd be like all in, and this conversation would just be moving right along, no problems. But like we went to a store and there was all of these different crystals, and it was like you could get this rock and it would help you with this, and you would have this rock and it would help you with that. And this is where, to me, the placebo effect totally buys in. Like if I would love to sit with anybody that can actually tell me which rock is in the room with them and whether it's there or not. Like that's kind of how my brain.
But do you
works.
think the placebo effect is not real? Like it doesn't generate real changes in your body?
So the placebo effect, I think, is incredibly valuable. Like
so as long as it generates a placebo effect, who cares if the placebo effect it's healthy?
As long as it's affecting the mind, body, and spirit, then that's holistic medicine. It's everything. It's tapping into all parts. What I love about this conversation, and we have to take a quick break, And I'll say when we get back. All right. Time out.
Okay.
Right. We're back.
Right.
What I love about this, drink your kombucha. I ramble, so be comfortable.
Hey,
What I love
so
about
I actually have crystals here in the room with me. Do you
of
guys
course
have
you
crystals?
do, because yeah, absolutely.
Okay, just checking.
Like so many.
Just checking. Sweet.
Yes.
Lily was like, he's messing with my crystals.
She's like, don't even talk about my crystals. No, but what I love about this, Lily, is that, and this is where I always struggle with my clients who really lean, because as a dog trainer, I am just a dog trainer, and there's so much that I have to just be like, hey, like you gotta, this is not my realm. I'm not a medical practitioner at all. I've taken a lot of nutritional courses, so I can guide in the nutritional realm for dogs, but like, I'm not a doctor. You got to go to the vet. And my clients who lean really heavy into traditional medicine, I feel like it's always kind of a struggle, because I do feel like veterinarians who are scientifically and medically trained have a hard time looking outside of the scope of medication, chemotherapy, like those sorts of things. They rely solely on that to solve the problem, even if it's not solving the problem, like prescription diets, even if they're not solving the problem. So what I love about having this conversation with you is that our listeners get to hear someone who does have that very, very medical background, who also sees the value in something not quite so medical as being useful for their pets. Because I have a lot of clients who are afraid to take that jump into like just trying acupuncture for pain management or regular chiropractic care for their pets. Do you do chiropractic care, by the way?
I don't do chiropractic right now, but I will say I had more exposure to that when I was in primary care of different people, because right now in my practice, basically the clients are self-selecting. By the time they already get to me, they want this. But before, in primary care, it was part of my pitch was that, hey, let's try acupuncture, because if it doesn't work, it just doesn't work. There's no harm, no side effects. Like, there is financial commitment. That's really the only thing. Like, that's an investment you have to put out. If it doesn't work, then yes, like it costed you some money. But what if it does? Like, what if it can make your pet more less painful and more comfortable? Like, what happens if we can help with this cancer? Like, are you willing to just try, knowing that there's really no side effects? And there are still some people that are like, just don't know. But most people are like, okay, let's give it a try. And that's really when I am able to see that transformation of like people seeing a difference and then turning their mind and be like, yeah, there's something to that. So I enjoy that process too.
And to be clear, I think there's something to a lot of it. Like, I'm not trying
all
to
of a sudden,
I mean, you got a long way to go to get me on the crystals type thing. And I've like, send me some information. Like, I would love to know more about it. But like I said, I mean, I think acupuncture is great. I think massage therapy is great. Like, all of those things, I really do get it. And I do mentally value the placebo effect, all of that. And I really, really appreciate that there's other solutions and other opportunities for people to get involved with their dogs, with their own healthcare, to really try different things, because the financial side of traditional medicine is become so overpowered that I don't know if we have any idea if it's in our best interest or not.
And here's something cool that probably a lot of people don't realize is most pet insurance want to cover holistic treatments. I have Lemonade for my dogs. I used to have Prudent Pet. Both of those insurance policies cover holistic care, from chiropractic care to physical therapy to acupuncture. So it's an add-on. Sure, it's not like considered primary care, but you can get it covered, I think, because the science is there. Like, the science is there. It does work. There are solutions. So just The science is there for crystals too, somewhere. I'll find it. Don't worry, Jason.
Can't wait.
Expect all the articles.
I'm waiting. We're about to find out how many listeners that we actually have on this show when we just get bombed with all of this.
Yeah,
stuff on
because
crystals.
of Jason's mansplaining about crystals.
I'm
Whatever,
not
Jason.
mansplaining anything.
Oh my goodness. Well, Dr. Lily Chen, thank you.
Oh, is it
so
really
much
over
for coming
already?
on. It's so over already. I know it went fast. I will say too, though, like just knowing what you're doing, I totally get why you want to have more time for your patients in your practice. Like this is stuff that you want to talk to people about and create that relationship and see that change. So I hope I want more vets to do it.
When are you going to go over, Sylvia? When are you going to go visit Miss
Like,
Lily?
I don't. When can I come see you? What's your availability? Where are you, by the way? Where are you located?
So I'm near Palos Verdes.
Okay, I'm
South Lake.
coming. I'm getting in the car right now. I'm just kidding. All right. So, because I know you've listened to at least one episode, so you do know that we end our show in a very special way. In a way only Jason could.
I've got a
Jason?
summer. Yeah, I'm set up with a summer joke as we're getting into summer. You ready?
Mm,
What
uh,
is a? All right. Okay.
Wait, what? No, hold on. I just want to. Maybe I'll do a spit take. So
I know
okay, I'm
it's
ready.
not that. I don't think it'll be that funny.
No.
No. What's a dog's favorite kind of ice cream? Popsicles, of course. But
Her face. She's all.
Is that considered ice cream?
Yeah, I don't.
Okay,
Is it
technicalities.
popsicle ice cream?
She's like, I'm gonna
I
poke
agree.
holes.
See,
You
I
came for the
love this
crystals, and your
scientific mind.
jokes are going
Yeah.
down.
Yes, girl power. That was me high fiving you, by the way. Yes, yeah. All right. Sorry, Jason.
It's all right.
We're done. We're
Thanks
done.
so much for coming on
Thank
the show,
you
Lily.
so much. This
Oh,
was
it's
so
much
lovely.
fun. Thank
We'd
you
love
for
to.
having me.
Yeah, we'd love to have you back on and maybe hit like we were very broad and we kind of got into acupuncture, but I would love to kind of get focused on
Deep
specific
dives.
topics. That would be really cool.
Yeah, that'd be really cool.
Our resident veterinarian, Dr. Lily Chen.
Love
is
it.
back with another whammy. I can hear it already. All right, anyways. Thank you so much for joining us today. And we'll see you soon.
Awesome.
Thank you.
Bye.
Let's take a quick moment and say thank you so much to Dr. Lily Chan. I learned
I
a
know,
lot.
taking time out of her super busy day.
Yeah, very cool. And I can't wait for you to go visit and give us a quick little tour and tell us what it's like there.
I'm very much going to do that. Yes. Hunter could definitely use some acupuncture.
As always, anything that we talked about today, like products and websites, will be listed in the show notes over on our YouTube, on our website. And make sure you go over and subscribe to the podcast on iTunes and on YouTube and all of that kind of stuff.
Everywhere.
And then reach out to us. Like, people have been doing great reaching out and letting us know if there's a topic or a personality that they would love for us to have on the show. So until next time.
Yeah. Or if there's somebody that like you want us to have back because you're like, I did not get enough information.
Yeah.
Let us know so we can have that.
Lily will be one of those. And let me know.
Sure.
Like, was I mansplaining crystals? Like
I mean,
I want to know.
Wasn't. Tell Jason.
Yeah.
Drop your opinions in the comments on our gram.
Send them over.
Or just DM him angry DMs.
You can do that too.
Don't do that.
I can't wait until we start
It's
getting
at
hate
Jason
mail.
with an E.
Oh,
anyways.
Jason,
we'll see you guys.
Yeah. Awesome.
Okay.
Bye, guys.
Bye until next week.